When you're in chronic pain, you can feel yourself losing strength, stamina, and mobility. You may be told to exercise, but since the brain is hardwired to avoid what increases pain, motivation can really be a struggle. What do you do when you're in chronic pain and you want to start exercising, but you don't want to make things worse? In this episode of The Weekly Well, I'll share the body-brain science about chronic pain and how to use what only you know inside to ensure exercising helps you feel and function better now. Hi, I'm Janet Holtz, founder of Exercising Well. I'm a clinical exercise physiologist and health coach. I offer a simple, science-based solution to exercise for people limited by pain, stress, or low motivation. My secret sauce is my Be Well Now method, and the Weekly Well is your time to use this method to find your way out of the challenges to exercising consistently so you can enjoy whole person health right now. We start with a Be Well Now meditation so you can tap into you science, what only you know inside. So start by just making yourself as comfortable as possible. And when you're ready, close your eyes. Make any adjustments so that you have the least pain possible and you feel supported. And then simply notice how your body feels. And offer yourself kindness, acknowledging that it takes a lot of energy to be in chronic pain. And so just allow your body to rest as best it can, knowing it is trying to help you, but acknowledging that that is difficult and this is a challenge. And then bring your awareness to your center. Just notice your breath and notice what you know here about what's most important to you, your core why, what's most important to you about managing chronic pain and feeling and functioning your best. And just feel your breath moving in and out as a reminder that your body is taking care of you and you have this inner sense of knowing of what to do. Even if it's not always very clear, this inner sense, this inner knowing is so valuable. And then move your awareness to parts of your body that maybe are not as painful or not painful at all to move. And if there's no part in your body that's difficult to move, you might just keep noticing your breath, letting it expand a little bit longer and feel the movement of the breath. Or you might massage an area and do some gentle touch. Or you might try and just squeeze and release. Notice what reduces pain, even in the slightest. If it feels okay, try some gentle range of motion and notice if that gently reduces pain. But notice how the pain can be a guide to moving in a way that will reduce pain, even in the slightest bit. And again, if there's no way to do that right now, just visualize yourself moving with less pain or even no pain. Let that visualization connect with what's important to you. So whenever you're ready, bring your body back to stillness if it's moving. Feel your breath taking care of you. And again, notice all that you know inside. And whenever you're ready, bring your awareness back to the room. And go ahead and open your eyes. So let's look at the body and brain science of chronic pain. The physiology of acute pain is the body telling the brain there's a problem and the pain is a signal that it needs to get your attention. The physiology of chronic pain, however, is very different. The brain starts to hyper-protect that area and it sends extra pain signals to provide protection. There's a mismatch then between the level of injury and the pain levels. This is why pain scientists are raising awareness that chronic pain needs a very different treatment than acute pain does. One of the main factors that contributes to chronic pain is deconditioning. It worsens stiffness, adds to limitations, and adds strain to other areas of the body when you move. Brain scientists also know that stress increases chronic pain. But since chronic pain is a stressor in and of itself, this can keep you in a vicious cycle. There's great evidence about ways to treat these root causes of chronic pain. Mindfulness, self-kindness, And movement science-based exercise treats both the deconditioning and the brain's hyperprotection of the body. Movement science is the way to move with the greatest strength and the least strain. It's moving the way your body is designed. This way, your body is telling your brain there's support, and that restores confidence that you can move without making things worse. Mindful self-compassion keeps you able to listen to your body and keeps you willing to respond in ways that are most likely to calm the brain side of chronic pain and lower stress levels. Let's use the well habit system steps to make exercising to manage chronic pain a habit. It all revolves around your core why, so make sure you have that clarified using the link that I provide below. The first step of the well habit system is to clarify what to do. So what to do to reduce chronic pain. Know that your body needs a balance of mobility, strength, and stamina for movements of daily life. When these are in balance, your body starts to restore the skills for moving with greater ease and less strain. So do a balance of exercises for strength, stamina, and mobility, stretching, strength exercises, and cardiovascular exercise. But make sure those movements are functional, meaning they're movements of daily life. Your body adapts to exactly what you practice during exercise. So avoid exercises that ask your body to do something it's not designed to do. For example, sit-ups and planks and toning exercises. They're just not the way your body's designed to move and thus can cause more pain and strain. The second step is doing enough to spiral up. When it comes to chronic pain, that's enough to reduce pain levels. So your inner trainer, or what only you can feel inside, is the best way to know how much is enough. When moving lowers pain, it's an anti-inflammatory. When it increases pain, it's a pro-inflammatory. The 1-2-3 template for enough exercise that I link below gives you a general guide for how much is enough for each type. But by moving mindfully as an act of self-kindness, pain becomes a guide rather than a threat. This is not easy, especially when you've been dealing with pain in your body for a long time. But with practice, you can learn how to listen to and use exercise and movement as a way to manage chronic pain. Below, I've linked a mindful movement meditation for when you're in pain. Practicing that meditation helps you learn how to use pain as a guide. The third step is to link consistent bouts of pain-reducing movement. So you get these small doses of anti-inflammatory throughout the day while improving your strength, stamina, and mobility. So link small bouts of pain-reducing, science-based movement into times of your day that you're most likely to do it. Link it to things like eating, or when you're using the microwave, or when you go to the bathroom. So that way, throughout the day, you have these little bouts of movement that are like taking a little long-acting anti-inflammatory. The fourth step is to use Thrive tracking to note in some way by writing down what you did and how you felt. So you can learn what your body is telling you about how to use exercise to reduce inflammation and improve function. This week, take time to notice your mindset about pain and practice moving with confidence. Learn how in my step-by-step Start Well program. It uses movement science, motivation science, and use science by integrating mindful self-compassion to gradually build those whole person skills to use exercise to help manage chronic pain by treating its root causes. Post your comments and your questions below, and please share this with anybody who you know is limited by chronic pain. Have a good week.